Well, there is new data in terms of outcome. So there was the information that was presented from Sunnybrook and the University of Toronto at the GU ASCO in 2015 that showed that for patients with intermediate risk prostate cancer, the concept of active surveillance is associated with a higher recurrence rate of prostate cancer and an increased prostate cancer mortality. So that information says that we have to be very careful about our selection criteria. Certainly for the patient with low-risk prostate cancer, this longitudinal data shows that the vast majority of people are doing very well, but that for the patient with intermediate risk prostate cancer, there is almost a fourfold increase in prostate cancer-specific mortality at 15 years. So our selection criteria is very important. And then we have the concept of how are we going to integrate the genetic profiling and the individualization into our patients. And again, I think that the selection criteria for active surveillance is predominantly based on the NCCN guidelines of establishing, for me, very low-risk prostate cancer with confirmatory saturation biopsies to be certain that nothing's being missed, and then incorporating into that multiparametric MRI and looking at the genomic testing. And for me, that is reassuring in the selection criteria. So I think that there is a lot that's new, but not enough confirmatory long-term evidence that these new tests are sufficiently accurate to avoid all concern and angst about placing a patient on surveillance.